In some ways, last year, for our staff and families, it was a little simpler. If you were tested positive for COVID, you stayed home. And if you were in the hybrid program, you still stayed home. In some ways, there was some simplicity to that. It's not as simple this year because it involves vaccinated folks have a different rule. Not everyone is vaccinated, and so that complicates how you treat different students even within a class. The symptoms are different based on the rules, and vaccinations are not. Trying to think about the rules outside of the schools, which are different public health rules than some of the rules inside schools. So this can be confusing for the adults involved. I'm not going to try to end all the confusion this evening, but I did want to point out to the community that what does it mean to quarantine and no quarantine? So just briefly, unvaccinated individuals who are identified as a close contact in school will quarantine, and they'll follow our quarantine protocols, or they can participate in the test and stay protocol, which I'll go through in a moment. Partially vaccinated individuals, and by the way, we know we have a significantly high vaccination rate among the Needham community, within the Needham community, but there are still some who are only partially vaccinated. They would be identified as a close contact. They either have to quarantine or again follow the test and stay protocol. Vaccinated individuals identified as a close contact who have symptoms at any time, they must isolate, and they can come back after a negative COVID PCR test, and then they would follow our test and stay program. So some of these different, we have some different flow charts on our website that explain this, but I just wanted to, this high level explanation. Now, if you are not being quarantined, so vaccinated individuals who have no symptoms are exempt from quarantine, even if you are identified as a close contact. However, we're recommending that you have a PCR test within 3 to 5 days. Individuals who recovered from COVID-19 in the last 90 days, the same thing. Classroom close contacts, and we have had some classroom close contacts. An individual who is exposed to a COVID-19 positive individual in the classroom while both individuals were masked, so long as the individuals were spaced at least 3 feet apart, are exempt from testing and quarantine. So it's possible in a classroom where teachers are encouraged to keep their class rosters and charts. A student in one part of the classroom may be in a classroom where there is a positive individual, but they may not be deemed a close contact. They might have last year, but they aren't this year because they are more than 3 feet apart from the student and masked. And bus close contacts, individuals who are on buses where the windows are open are exempt from testing and quarantine. So in some ways, the rules are confusion, and to be honest with you, sometimes they're a little inconsistent, and that's the reality that we're living with inside the schoolhouse. I think it's a little bit more clear out in the community, perhaps, but we do have some protocols and rules in place in schools that you do have to take some time to understand and wrap your head around. So I would like to talk to, and I will lean on certainly Mary Lammy and Kathleen as necessary, Kathleen in particular with one piece, to let you know, and Kathleen, come on up, thank you. We're very pleased to let you know that we are participating in the state's program. And our contractor, because the state is contracting this work out, is CIC Health. And that's the consent form that families will fill out when they go onto the website. There are 3 components to the program: test and stay, symptomatic testing, and COVID safety checks. For now, although families are signing consent for all 3 tests, we right now are only implementing the test and stay component, and I'll explain what that is, but basically it's giving a student or a staff member a antigen test in school, and if it's negative, they can return to class. Let me try to demonstrate, if I can, what this means. So if a student is positive and is identified as positive, then we do contact tracing, and we identify the asymptomatic close contacts. So as you can see, not everybody is necessarily a close contact, but in this sample, 2 are. They happen to be asymptomatic. They are close contacts. And so those asymptomatic individuals are tested in school for at least 5 and up to 7 days of testing with the Binex Now. It is a nasal swab. I believe it takes 15 minutes for the result. If it's negative, the child, the staff member, goes back to class. And this is important, they remain in school activities. And I'll emphasize that in a moment. They participate, they continue to participate in school activities. Students involved in the Test and Stay program, however, are not allowed to participate in out-of-school programs or activities until the quarantine period ends. So, full participation in school activities. However, everything outside of school, and this is not only a challenge for some families, but it is also where we have to enlist families to be in partnership with us, because they have to make wise choices and decisions that may be at odds with what the child may want to do or with what some other folks in the community are doing. So families cannot participate, individuals cannot participate in play dates, in religious instruction, parties, scouting, overnights, other activities until that period of quarantining ends. And again, we need families' cooperation to really make that a reality so that we can keep students in school. And again, that is the overall goal, to keep students in school. Now, some other things you need to know about Test and Stay. As I said, families have to consent, and 99% have, which I'm still a little 99% in anything. This is a brand new process. It has never been done before at this scale in Massachusetts, and certainly not in our community. And so it's going to be imperfect. There are going to be hiccups, it's going to be uneven, and a school committee member may get a phone call and say, look what happened at my daughter's school, it didn't happen over there. And I'll tell you, yes, that will probably occur. However, knowing this staff and this community, we will, as we roll it out, we will get it right, and we will make sure that we're evening things up. We're still waiting for some supplies, by the way, and for people. The state is providing the resources for this program. Not all of the resources, though. It is still people, staff intensive. Teachers, nurses, principals, TAs, it's an all-hands-on-deck approach. All of us will need to coordinate and work with those children to help them leave the classroom for the testing, wait with them while they are physically distanced, while the testing results are coming in, bring them back to class, and manage all the conversations and phone calls with families. The state and CIC are providing some resources, but they're not providing all the resources. So we have to make this smooth. We have a good staff, we have a committed staff, and it's going to be a big lift for everybody to get this right. And finally, it is likely, as we experience this, that we may need to shift our plans. We may need to go in a slightly different direction or try something else to make sure that Test and Stay fits right for Needham and works for Needham.